We talk so much about the stories of our childhoods and how they impact our lives. And I've shared that me realizing, literally in a doctoral program, because of the stigma of borderline, that my mother has and had very strong traits of borderline was a life-changing moment for me because it flipped the script on I'm the bad child. Maybe I am the bad child, the bad daughter that she says I am, in spite of me paying for her, taking care of her, being her emotional partner, dragging her throughout my marriage, different cities, buying her cars, like everything, just trying to always get love from really the only person in my life that was really an attachment figure. And so I want to talk today about something that I found in an article, a new article around dissociation and the intergenerational transmission of trauma from children of borderline mothers, for example. And we're using mothers, though anyone, and we know the statistics are much higher for men. It just often looks different. In fact, a large number of men with borderline are often in our correctional systems. There tends to be a more acting out piece that puts them more at risk for that type of consequence. And their own struggles are significant, just like for women or anyone else, however you identify. And we know that the pieces of borderline really are genetic, and they're part of our brain structure, they're part of trauma, like there's a lot going on. And even this article talks about not everything is trauma when it comes to borderline. But more importantly, why I want to make this video is that it's becoming more and more clear to me how many, at least high-masking women in particular, have been diagnosed as borderline, when in fact they might have some trauma or subclinical trauma traits or responses, but in large part, they are often autistic in many cases, nowhere close to all, but it's really important if you've received this diagnosis and if you relate to a lot of the criteria around autism, especially as it might present in women or the female phenotype, but once again, for anyone, to pursue more information for yourself for validation and treatment and things like that. And so we're going to talk about several research articles, define some terms around borderline, intergenerational trauma, autism, and then dissociation and anger, as they are often pieces of what I think it feels like to be on the outside in, or really inside the system, with a parent who might struggle with something like undiagnosed and untreated borderline personality. I have no interest in further stigmatizing, but like I said, for me, because it was so stigmatized, I didn't recognize it in my own family system. I knew my mom wasn't quite like other moms, but she could also be incredible and loving and fun. And what I thought was helpful, over time, there was quite a price for that. So I have like childhood trauma with the version of her that I believe struggled. And then really where it got so much worse in many regards was in my adult life. What made me think about this is I cannot tell you how much I love the show called Hacks on HBO with Jean Smart and Hannah Einbinder. So good. I just finished season 3 last night. But what I want to share with you, and I just saw an article about sort of the more feminist or queer analogy of the show. What comes up for me is a lot of mommy issues, a lot of stuff around the mother dynamic, not to remove those other lenses, but especially this piece between the character of Ava Daniels, who is a writer, and Jean Smart, Deborah Vance, who plays this like aging comedian, was like very famous and just got her first late night show. Oh, that's a spoiler. So if you just started watching it, I'm sorry. But the point is that they have this really kind of crazy dynamic. And both of them have this sort of narcissistic at times wound for different reasons. We're getting more and more information about the mothering dynamic. But the core of this, and what I want to talk about today, is their good love and bad love. The parts where they feel like they're so connected and things are good, and then the splitting that often occurs. And it often really comes at the hands of Deborah. I mean, it really is. Ava sometimes tries to manage things, but it's this feeling I had with my mom. And I was like, watching this show, it makes me it's such an incredible show. It's funny, it's moving, and it's real in so many ways and entertaining, but It's this really complicated type of relationship that I kind of had in a different version with my mom. And so I thought that, one of the pieces that I think is really profound is the quick to anger component of borderline. Just a quick reminder, borderline really is a personality disorder that is complex, and really it's about instability in the person's emotions, relationships, mental capacity, identity, with a core piece around fear of abandonment and many other things. But it's this like moving dynamic where it's not usually bad all of the time. It can be on the high end, but like everything else, it's a spectrum. And so what we see often is like when you're standing in that borderline light, it feels so good. It feels like connection. I've said it in many videos, it's been a while, but my mom and I's best years were the very handful of years between my father passing and her getting divorced from my stepfather after 15 years within a month of each other, and me never seeing either one of them obviously again. And then before I got married. And so I was pretty traumatized, didn't really date. It was just the two of us for many of those years. And there were bumps, but like that was the best. We traveled together. My mom had a wicked sense of humor. It's just that anytime it felt like I was leaving her and my marriage began to trigger, I'm leaving her. And every child I had, and if you're new here, I have 4 of them who are almost all grown. One's almost out of the nest. It was like a threat to her. And so my point is that this relationship on the show makes me think about it so much, the high highs and the low lows. But one of the complex pieces, like I'm saying, is Deborah's anger and Deborah's inability to think about other people other than herself. Now, I'm not saying Deborah is borderline. She has more of a narcissistic profile for sure. I haven't seen a lot. I mean, there could be elements and layers, which there often are, but she's very much more avoidant, more narcissistic in that way. And Ava has some mommy issues too with being seen. They both do. So the point is, though, that the anger piece for my mom was a huge one. And for many people who have borderline, they can have this quick to anger, intensity anger situation. And what often happens is it's a quick stress-induced situation. And one of the other criteria is this transient, often dissociation, the stress-induced transient, we'll talk more about that, dissociation. Meaning that I think what would happen sometimes for my mom and for many people who struggle with borderline is that when they get really angry, they sort of go somewhere else. And this is why oftentimes they will say to you, I didn't say that. I would never say that to you, or not remember their role in things or what they might have said or done. And certainly there can be a level of, anger and aggression and violence and self-wounding as a result of those pieces. And the dissociative part, if it's part of their trauma history, can make it worse. I keep saying it, but my mom did not and does not have, at least as far as I know, a significant trauma history in childhood, though my non-biological father did. So I'm not saying there weren't things that weren't relationally traumatic, but the point is, it wasn't your classic high clinical, dissociated, very traumatized person. It didn't look like that. It's very charming, very engaging. Some narcissistic pieces, some ADHD pieces. And yes, I'm still trying to assess the autism pieces, and I'm not fully sure yet. The cruelty and the abandonment piece is what dominates. And so I feel like that, just from what I've learned so far, and I'm always willing to learn new things, but that just feels so much more borderline than autism, at least from what I understand so far. It feels like those with autism are much more likely to isolate, not that they all do at all, but I'm more inclined to I don't need anybody, as opposed to my biggest fear is being a burden to my children, for example, even though I only have them, and so there's a reality to that, but I'm always I don't want to put that on them. And of course, certain things get put on kids because that's how life goes. But the point is that when you're a child and you're witnessing your parent rage at you and go off on you and say horrible things to you, and then later deny it, not make repairs, there might be these pieces that I think are important. And so I want to talk about borderline and autism, and I want you to think about, if you had a caregiver like this, that to kind of begin to speculate and look at, could there be an autistic piece? Is this borderline piece impactful? And the last article, I know this is a long intro and I'm sorry, the last article is about the intergenerational transmission of dissociation on children and trauma on children of borderline mothers, okay? So we've defined borderline. I think most of you here know what that is, and we know that that borderline rage piece can be a huge part of that difficulty. Now, it could be an externalized yelling, screaming rage. It could be that more quiet, vulnerable kind of borderline dynamic, but often what triggers that is a fear of rejection, of not being appreciated or loved or being abandoned. And so all of that can kind of light the fire. And then if you think about perhaps someone with autism or neurodivergence, ADHD, for example, I've never met anybody with ADHD that didn't have some underlying anger issues as a result of that limited dysfunction, executive dysfunction and impulsivity sometimes. And so just keep holding those things in mind. So, of course, we have, like I said, self-image issues, impulsivity, all of that are also part of borderline. Now, what is intergenerational trauma, for example? Why are we talking about this? Because we're talking about, if you're here, hopefully trying to understand yourself and change your life, and hopefully not reenact the same traumas any more than you already have on yourself, your loved ones, or at least to be a work in progress. And that is kind of this whole history of intergenerational trauma, that what happens to our, ancestors, it isn't just you have to be there. It lives in our DNA and our cells and through epigenetics, which is how genes in the environment mix and sort of turn genes off or on. That's a brief, very minimal version. How might a borderline grandmother, for example, have affected me? Not just my mom, but me. So, according to the APA, the transmission of trauma or its legacy in the form of a psychological consequence of an injury or attack, poverty, and so forth, from the generation experiencing the trauma to subsequent generations. The transference of this effect is believed to be epigenetic. That is, the transmission affects the chemical marker for a gene rather than the gene itself. The chemical marker is what's affecting it. The trauma experienced by the older generation is translated into a genetic adaptation that can be passed on to successive generations. Now, it says, this is interesting, the trauma reactions vary by generation, but often include shame, increased anxiety and guilt, a heightened sense of vulnerability and helplessness, low self-esteem, depression, self-wounding, substance abuse, dissociation, my favorite one, hypervigilance, intrusive thoughts, dealing with relationships and attachment to others, difficulty in regulating aggression, and an extreme reactivity to stress. The exact mechanisms of this phenomenon remain unknown, but are believed to involve effects on relationship skills, personal behavior, and attitudes and beliefs that affect subsequent generations. The role of parental communication about the event, the role of parental communication, so them talking to you about it, and the nature of family functioning appear to be particularly important in the trauma transmission. Now, it turns out that they might not talk about it, but the ways they live their life, their fear of losing you, they might talk a lot about their trauma histories. And this research has really come from looking at the children and grandchildren and great-grandchildren of survivors of the Holocaust, Japanese internment camps, historical issues around racism and slavery, American Indian communities, the families of Vietnam War veterans, and others. It's also called historical trauma, multi-generational trauma, or secondary traumatization. So that gives you the kind of the backdrop of how we're trying to understand. And what I really want, I know this video might feel like all over the place, but I'm going to try to bring it home, which is if you were raised by a parent who you believe had significant trauma, oftentimes it can be borderline autism, something undiagnosed, and you live in a state of extreme sensitivity to people's moods and emotions, which is the hypervigilance piece. So you're always scanning to detect changes, especially around anger, because if you had a parent like this, being that emotional dysregulation is often at the heart, and anger, that affects how you live your life, how you engage or don't with people, why you might avoid social things, why you might always think you're in trouble or blame yourself. And it might also affect how you deal with your own trauma through your own dissociation, through spacing out, maladaptive daydreaming, full-on depersonalization and derealization, feeling disconnected to yourself, your body, or reality, things like that. So this is like to help you look at if you had this childhood and you may have these pieces of borderline autism or your parents did, and how anger and dissociation and trauma are generating through your story, okay? Just really quickly, once again, autism is a neurodevelopmental disorder characterized by impaired social interactions, verbal and nonverbal communication, narrow interests, repetitive behavior, and things of that nature. Most of you know what that is, but quick update. And then once again, to live, so there's hypervigilance, like in Here Comes the Bear, I'm scanning to what to do, fight, flight, flee, all that stuff. And then there's chronic hypervigilance, which is a very real piece, and it is why I made this course on the hypervigilant trauma personality from eggshell, what I call eggshell, which very often includes parents with disorders like borderline, narcissism, autism, ADHD, bipolar, things like that. And this course is full of really everything you can imagine. You've already seen me talk to you about this. And by the way, there's a free link at the end of this video below to take 3 of the lessons for free. And it's also a free course. And of course, my OG course on those of us raised by parents that really dives into borderline and narcissism. The point is, chronic threat assessment is really the heart of hypervigilance, of chronic hypervigilance. We are always in that state of fight or flight more often than not, unless we are isolating or alone, numbing, dissociating, things like that. And I will say that it turns out the big crossroad between autism and trauma, which pretty much overlap, is often hypervigilance. Hypervigilance is extremely common in autism to scan for especially social dynamics, but also with the nervous system often living more in that activated state, that sympathetic state. So now let's just talk quickly about some articles. The first article that I looked at talked about anger instability and aggression in borderline personality disorder. And all of these articles were published in the last, I think, 2 to 3 years. I think there's no article or research project older than 2021. And of course, they found that those patients with borderline reported greater instability in their experienced anger compared to healthy participants. Most interestingly, in the BPD group, the occurrence of aggressive behavior was significantly associated with the level of anger intensity, as well as the level of anger instability. More precisely, on days when patients with BPD acted out aggressively, they reported higher anger intensity as well as a greater anger instability than on days when they did not. So the bottom line is there's a lot of research around those with borderline struggling with anger. And that is the heart of walking on eggshells with parents like this. When you don't know what is going to come next, you have to always be in a state of preparation, of hypervigilance, of fight or flight. And for my mom, she used to even, I remember, joke about it and be like, oh, being a parent, which is sort of true. This part's true, but it's really true for her that I could do one thing one day and she'd think it was like fine. And the next day I could get in a lot of trouble for it. She could be really triggered by that. So we know that there's an anger component that's quite significant. And what's interesting about this article is that, there was an association between how much instability was going on, how angry they were, because physical aggression, violence can clearly come out of a type of rage that can be related to borderline, though it may be a mental rage, an emotional rage, right? It can really vary. So now let's get into how dissociation plays out. Like I said in the beginning, I really think that sometimes those with borderline, when they get triggered by a stress reaction, rejection, sensitivity to abandonment, feeling unappreciated, that can trigger and spark a rage. And in that rage, there can be a dissociative response. I'm not saying all of the time or anywhere close, but I really do believe that part of what happens for them is why they may lack some self-awareness at times. If they are dissociating in that rage, they're not really there in many regards, right? And so and they could also be going back into their own trauma stories. There's some research talking about how the infant, the baby's crying triggers the child's behaviors can trigger someone with borderline into their own childhood memories and their own unprocessed traumas and wounds. So the first one really looked at the relationship between dissociation and the implications of it in terms of research and clinical practice in those with borderline. And just a quick reminder, to be in a sense of, a state of dissociation generally, you can feel detached from yourself, from your body, from reality, from the world. It can feel as though the world's not real. There can be mood shifts and kind of mind shifts, a loss of control, a fog, memory, concentration issues, and difficulty handling intense emotions. And so this study really looked at it and said that, the thing is, we haven't really studied a whole lot about dissociation and how it affects those with borderline and how it might affect them as caregivers, despite the fact that up to 80% of BPD patients identify experiencing dissociation. And so all these articles were super long, but the bottom line was that it was a review, a literature review. This scoping review found that dissociation in BPD to be correlated with BPD symptom severity, self-wounding. So this is how dissociation can affect BPD. It can affect therapy treatment responses, reduced mindfulness, how they use or engage in sedative substance abuse. There's a dynamic here around sedatives, cognitive deficits, personality fragmentation, fearful attachment, altered pain perception. So when you're dissociated, you often don't feel pain. And that can go obviously along with self-wounding, altered stress response, and multiple other dynamics. Not to mention that those with trauma and dissociation with borderline were less likely to be able to defend themselves against further victimization because they might go into a dissociation, not be able to protect themselves, self-advocate in certain situations if they were also traumatic. So the second study looked again at dissociation, trauma, and borderline. And same thing, it talks about the effects of dissociation on psychosocial functioning may depend on the larger psychopathological context. For example, how does the person deal with emotional dysregulation? How do they see themselves in terms of identity? It says this: in BPD, stress-related dissociation, remember I'm talking about how that trigger, that spark, is a core symptom closely linked to other features of the disorder. Up to 80% of patients with BPD report transient, so not permanent, but moving, dissociative symptoms such as derealization, depersonalization, numbing, and analgesia, which is basically not feeling pain. And it talks about that while trauma is an important risk factor for the etiology of borderline in those with genetic and temperamental neurobiological vulnerabilities, non-trauma related pathways are also involved. And that dissociation in BPD is closely linked to emotion dysregulation, disturbed identity, and relationship problems. Now, thinking about that kind of summary, we're talking about issues regulating emotions, issues regulating distress, dissociation, managing anger. How are we thinking that's going to affect caregiving, given the fact that being a parent is one of, I believe, the hardest things on the planet? It is exhausting. It is often lonely. We know that majority of caregivers, though anyone can be a caregiver, are still women, by and large, and that we are vastly undersupported. And I have been a full-time stay-at-home mommy. I have been a full-time single mother working. And frankly, staying at home in terms of the mental load is the hardest, if you ask me. And often I think the least appreciated. And often a sense of identity is lost, even without any trauma in those roles. So we have lack of mental, physical, and emotional supports. And if you go into that experience with something like untreated borderline, unrecognized autism, ADHD, something else trauma-related that affects your ability to manage stress, and you have a greater sensitivity to rejection, to fear, to scanning people, to looking for evidence, even in your own child, that your child doesn't like you or is mad at you, which happens. If you don't have a good barrier around that, it can be very, very triggering. Not to mention when you get into the teenage years and kids are supposed to kind of push back. That, for those who are not well defended psychologically, it can feel very personal when in many regards it's not. It can be, but not always. So this article talks about the role of identity and how all of these things can manifest in terms of dissociation. So the bottom line is That study once again reinforces this intermix and how all of those dynamics can make it difficult for somebody. The last study is really the core of this, which is how do we want to make sense or understand our own trauma responses through the lens of what may have been our undiagnosed parents with something like borderline, trauma, autism, and all of those things. And this article is called Dissociation in Mothers with Borderline Personality Disorder, a Possible Mechanism for Transmission of Intergenerational Trauma, ? And so it's a pretty significant study in terms of the review. The bottom line is that there's not a lot of cohesiveness, even though we talk and are talking so much more about the impact of parental psychopathology on our kids. When parents struggle, kids are going to struggle. But oftentimes I think that we haven't really looked at enough the impact, when I do believe that there are, and frankly, more people I've worked with who think their parents, I've said this a million times, are just narcissists, when actually there's a big piece of something that looks like big emotional dysregulation that I think often falls into that borderline and possibly now autism related dynamic. And so it talks about how borderline affects caregiving. It says BPD affects roughly 1 to 6% of the population, with an overrepresentation in psychiatric contexts, meaning in mental hospitals, things like that, for illness, at around 10 to 15%. So in those highly clinical populations, we see a lot more borderline. That's the higher end of the spectrum. These are the parents that probably were removed from the home, may have been hospitalized, things like that. And that the rates of BPD in caregivers in a clinical context are estimated to be around 14%. That's a pretty significant amount when you think about how the system in a family is affected by a caregiver who struggles. And it says those with BPD are more likely to experience a host of negative outcomes, including self-wounding and no longer being here, and a lower quality of life and relationships. But to date, there has been relatively limited evidence on BPD parenting practices. So now I want to kind of combine this idea again of autism from the lens of sensory triggers, from a child crying with colic and not stopping, from animals barking and sounds and sensory triggers to fabric, lights, things that you may not even be aware of, and also the trauma triggers for both those potentially on the spectrum or with just borderline. There is some evidence to suggest that BPD mothers may experience difficulty providing care to distressed infants as the duration of infant distress increases, like I was just saying with the colic. Research suggests also that mothers with BPD may experience particular subjective difficulty in response to persistent crying from their infants. My mom has laughed about how she would leave me in the apartment alone in my crib and go to her neighbors and have coffee because I cried so much as a kid. And so look, parenting practices changed, but the point is she would say, I can't tolerate your crying. I could never stand your crying. And maybe there was an emotional trigger there, but perhaps there was a big sensory trigger that she wasn't aware of. The point is, if you are deeply impacted by that, and even the best of us know how deeply inherently stressful it is when your infant, especially, or your child that you can't control, won't stop crying, right? So we're adding layers around our trauma. Perhaps we're being triggered, or they are, our sensory issues, overstimulation, and things like that. So it talks then again about the role of dissociation in borderline parents, and that there's this thing they might call dissociative caregiving, and that basically there's this disruption in how the parent is experiencing the world and their kind of psychological system. So there can be these basically brief state disruptions, right? So you're going along, and what is the difference between state and trait? So a state dissociation, state, is a transient state, so it's comes and goes, linked to stress or traumatic cues. For example, derealization during a traumatic event, not feeling like connected to yourself, your body, reality, things like that, or depersonalization. Whereas trait dissociation is a more enduring pattern. Trait dissociation refers to relatively stable individual differences in dissociative experiences, compared with other psychiatric disorders, trait dissociation is highly prevalent among those with a diagnosis of borderline. So what does all that mean? That means that for some of us, if we're borderline, for example, we could have these like intermittent states of dissociation, like the child's crying, the baby won't stop crying, and now it triggers me, and now I'm back in my own childhood and a trauma response, and I'm kind of like detached from myself. And or in a more trait dynamic, it's more of a frequent common part of how we function, the way we are. It's more of a stable experience of dissociation. So it's not so transient. It might be much more frequent, much more part of that dynamic. And so the bottom line is that looking at functional research into dissociation and borderline, there is evidence that when dissociation is induced, people with BPD appear less able to inhibit negative emotional responses and appear to find it harder to focus on non-aversive stimuli. The mechanism of dissociation is possibly disruptive in those with BPD in their attempts to deploy positive parenting behaviors. So the bottom line is that there are many studies that show that dissociation in mothers has a significant impact as a caregiving dynamic on the child, right? Because if we're together as a pair bond and I dissociate, I'm there but not there. And so the child is not feeling seen or heard, let alone what else could be happening in a more significant dissociative state. And so dissociation in mothers has been found to predict dissociation in children. So now here we are landing at us. Many of us raised, for example, by these kind of parents who struggled. And yet, I think that we don't necessarily understand why I have clients who do a lot of maladaptive daydreaming, who spend a lot of time in limerence and other worlds and fantasy and dissociative states, who lose focus, right, for so many reasons. And it may be that we are part of this intergenerational transmission of dissociation, not just in general, but also as it might relate to the parents, not just caregiving, but also, like I mentioned earlier, how their anger or emotional mood shifts might be impacted. And what am I saying? What I'm saying is that kind of coming back once again to this whole topic, which is what I realize is like the biggest thing of my life, that even in a marriage that looked nothing like my childhood, I was always scanning and looking for mood and mind changes and making meaning and responding. And so if we have been trained to do this with a parent who struggles with something like borderline, we're talking about constantly scanning, constantly reading, making meaning, and perhaps it impacting how we deal with anger, how we don't deal with our anger, how we interpret what we think is anger, and how we might cope, how we might be triggered by our partner who gets mad at us and now we're dissociating and they're like, where did you go? I was just talking to you. Things like that. And so there's lots of theories about this, but the one I thought was the most interesting in this article says this. And so let's just boil it down. Elsewhere, some accounts suggest that BPD may have roots in disorganized patterns of attachment. Now, I talk a lot about disorganized attachment because I think for so many of us, and especially if you had a parent with high highs and low lows, who you walked on eggshells with, there's a very good chance that you had a parent who had a pattern of disorganized attachment. And we know that that can definitely be related to those with borderline. We can see in borderline individuals, they much more often have a disorganized attachment or fearful avoidant attachment. And this is when, once again, the source of safety, the parent, is also the source of fear. So my mom, who I loved and adored so much, was my caregiver, but also the person I was most afraid of when she got upset, for example, or you did. So it says this, specifically, parents who display so-called frightened or frightening behaviors. Remember, borderlines who struggle, people with borderline, can be frightened and scared of you and also frightening, looming large in your face, things like that. That's a common dynamic in disorganized attachment. And so that may contribute, are thought to contribute to the infant's disorganization when the mother displays them. So we're passing on these disorganized attachment patterns. If the source of safety is also the source of fear and we're the baby, we're going to learn most likely to have both anxious and avoidant patterns in our attachment. I love you, don't leave me, I'm panicked, you're my only source. you're not safe, I can't let you in. Being vulnerable is dangerous, like in my childhood. And that is also what I see in autism. We can see this like anxiety and hyper focus and hypervigilance. And then often because of our nervous systems with our trauma, a tendency to want to isolate. So I hope this is all making sense. And maybe I'm going too over the board here, but these are really the overlaps. There's a lot of overlap between trauma and autism and neurodivergence in general, as trauma is part of that. And then how our attachment patterns might play out. It can very much be related. And I keep saying this, I think many people who are now being late diagnosed as autistic are realizing they're not just autistic, but they had trauma, and that their parents were some form of likely undiagnosed, untreated, autistic, borderline, both, traumatized, all of that. It's often in a system, right? So it says that these behaviors can affect kind of how the offspring grow up and how we sort of make sense of our own wounds, that the disorganized attachment experience is highly correlated with an adult experience of dissociation. It is highly correlated with the experience of disorganized attachment. And it follows that there is perhaps a correlation between dissociative symptoms and borderline through the experience of disorganized attachment. Okay, so that's what I'm saying, is that these kind of parents are going to have more dissociative behaviors, and it's going to affect their ability to respond to us, to soothe us, to let us be seen, to meet our needs, to even see our needs perhaps. And all of this shows up in how we are struggling today. That's the whole thing. It says the caregiving context may present a neurobiologically primed situation in which caregivers may re-experience dissociative phenomena in relation to their offspring. What does that mean? That what I said earlier, that these parents are also having dissociative episodes or being triggered by their own children, thus impairing their ability to help and intervene and manage and respond in a parental way to their own children. There's a lot more in this, but this last part I underline, it says this, where the caregiver is also the cause of fear also. A uniquely stressful experience for the child is created. The child's physiological response in their body of heightened emotional activation, meaning attempts to elicit and get soothing behavior from the caregiver, may provoke dissociative experiences in the caregiver, which in BPD can manifest as maltreating or seriously disruptive behavior. What am I saying? I'm saying that not just the crying is triggering the parent, but the actual child reaching towards the parent to take me, soothe me, help me, that can also be triggering and cause a parent who may be undiagnosed and have more likelihood of dissociation to not just get angrier and not respond well, but to also dissociate further, like removing themselves from all of it. And so this whole thing is that dissociation can really be seen as an important predictor or relational dynamic to often the transmission of intergenerational trauma. So I'm going to sum this all up by saying this. There's so much more I could go through, and then we'll just get through some things you can do if your parents were BPD. But that I heard a story that my grandmother, who I loved, who died when I was 9, who I would visit on their farm as a kid. Apparently it was a huge 1,200 acre working farm or something like that, maybe bigger, I don't know. And she would go to sell the eggs, and if she didn't get the price she wanted, apparently it was not good. I heard the story when I was in my 40s from my godmother. And so I think my grandmother, my mom was the youngest of 4. She had 3 brothers. And then my mom, just like I have 3 boys and a daughter, which is so weird. My grandmother was also an only child like I am. So only child 4. But there may have been, my mom's trauma may have been my grandmother's inability to manage her anger. And my grandmother had a pretty significant trauma history. So my mom, had a better relationship, she thought, with her mom, but she moved away. But it may have been that my grandmother was dissociating and was angry and easily triggered, and my mom had to walk on eggshells. And it may have been part of that parenting dynamic so long ago that it was normal, but it may have been a big piece of her own borderline development. So the point is, If you are recognizing these things in yourself, you're saying, okay, if I think I had BPD caregivers, what can I do? Number one, look at the role of hypervigilance in your own life, which may be overly focused on detecting emotional shifts in others. And that might be especially true around how you respond to what you perceive as someone's anger or dissociation. So for example, if you're hypervigilant and someone gets sad, that might not be, you might detect it. You're probably a therapist, you might be, but it's not triggering. But if you read that your partner, your whatever, your kid is mad at you, and you have a history of trauma around anger and maybe anger and dissociation, that is going to affect how you respond and how dysregulated you get. Number two, examine the role of hypersensitivity and how you make assumptions and how you respond. I keep saying that hypervigilance meets, and I have it here. And by the way, you can also get access to these 2 free tests on the free preview course in the link down below. That it affects not just what you detect, your threat detector, but then how you believe it's your job to respond, to be hypersensitive, to be a people pleaser, a compulsive caretaker, a fawner. So look at those patterns in yourself. When you detect, what do you do? Number 3, look at anger as a trigger in yourself and in others and make assessments for yourself about how you think you're navigating that. Number 4, explore your own patterns of anger and how you respond. Is there a relationship to fear and anger? And potentially, if you dissociate or maladaptive daydream or get stuck in limerence, these kind of other places you go to manage your trauma, what is happening for you? And what would you like to work on or change? Number 5, explore your own dissociative patterns. Once again, do you check out? Do you numb out? Do you isolate? Do you dissociate? What does that look like? If you suspect if you have been told you're borderline and you think you might be also autistic, do not avoid looking at that. It is really important to look at potential overlap and or just misdiagnosis. You were misdiagnosed, that you were actually more autistic with trauma than you are borderline. That might affect how you focus on treatment. There are a lot of overlaps around some of the BPD treatments and autism treatments, but that's important. And there's just a quick reminder on dissociation, that when you feel dissociated, doing things like grounding techniques, breathing exercises, looking around the room, naming 5 things you can see, 4 things you can feel, 3 things you can hear, 2 things you smell, and 1 thing you can taste, using sweet candies or sour candies to kind of get yourself into the present, trying to notice in a chair, what does it feel like beneath my legs, my back, my body, moving your body in large muscle ways to kind of get grounded in the present, picking a mantra, grabbing an object that brings connection and pulls you back in the present and things like that. And then just once again, if you have issues around anger and you're not really sure what that looks like, go start to do some work on understanding how the transmission of the fear of anger or managing anger or dissociation, how all of that might have affected not just in your immediate parents, but your grandparents and beyond, how you are functioning today, especially when it comes to navigating emotional changes and how your brain might deal with those things through what might look like your own forms of dissociation, right? So that's it. And once again, this video I know is long, but I really like finding these articles and trying to just share them with you because I realize I've been trying to grow my Instagram account because I've neglected it. There's just so many great creators and everyone is a trauma expert, which is fine. But it's like, well, what else can I share that hasn't been shared in my also 400 plus videos? And as I'm really, more and more diving into this overlap between autism and trauma, neurodivergence, and really always coming back to my, the core of why I'm here, which is recognizing that as a clinical psychologist, I was raised by what I believe are 2 parents with borderline. My dad also had pretty strong narcissistic traits, also very much gender stuff, and possibly bipolar as well. Was not my biological father, as I've shared. I found that out by my mom late in life, in my mid-40s. And he was a Disneyland dad. I didn't see much, but every time I was with him, he was the greatest guy in the room, but also it was like eggshells all the time. And my mom was also eggshells. And then I became a parent who didn't make my kids walk on eggshells, but then chose a partner and had more trauma, and like on and on and on. My generational trauma was bigger than I even imagined when I began my younger life and had a family. And I just keep saying that if I had known these things, it might have changed my course, it might not have. I hope that it helps you in some way. And I'm curious to hear what you think about these experiences. So thank you for being here. Please stay safe and well. Have a beautiful day, and I'll see you soon. Bye.